much for keeping it KBC Channel 1. It's now 12 minutes past 8 a.m. Now, this morning, it's all about matters health. On Health Matters, we are talking about fibroids, putting fibroids into perspective. What is fibroids all about? I'm joined by Dr. Robert Abade. He is an obstetrician gynecologist from Mpcia Hospital. He'll be helping us, understand more about what fibroids is all about. All right. So if at all you have any questions and you want to know more about this, you can be able to send in those questions using our Twitter handle. You can tag them at Mpcia Hospital, right?
Yeah.
At R Abade, at KBC Television, and at Ram Aguko. The hashtag is Good Morning Kenya, also at Jane Wamboi. All right, so let's take this thing running, because research has gotten that we have an estimate of around 50 to 80% of women who end up getting fibroids at the age of 50 years. But we will start just by the basic, for the benefit of the viewer. What are fibroids?
Okay, now it's actually called uterine fibroids. So this is a benign tumor. A benign tumor means it's not a cancerous growth. It's a non-cancerous growth in the uterus. And we still do not understand why it arises, but it's believed to be more of due to some genetic reasons.
Right.
And also due to some hormonal influences.
You're saying it's a non-cancerous growth. So if someone has it, there is no chances of them getting any cancer in future?
There is a chance of it transforming into uterine cancer or uterine sarcoma, but it's very rare. That's why when someone has uterine fibroids, you can't go and remove it because we are afraid that you are at risk of getting cancer. However, if you have uterine fibroids beyond a certain age, especially beyond when you're around the menopausal period, and then it continues to grow, you start developing new symptoms, that's when we start worrying that maybe they could be converting into cancerous growth.
So for now, the cause is not yet known. Why someone has fibroids?
It's mainly just genetic, and actually it's more common amongst the blacks, Africans, compared to other races, yeah? And also it's also believed to be due to some influence by hormones produced by your body, by the ovary, that's estrogen and progesterone.
Okay.
Yes.
All right. So being black is actually
a risk factor.
It's a risk factor.
Yes. So it's actually the main cause. The commonest reason for performing hysterectomies, that is surgeries to remove the uterus amongst the blacks, is due to complications related to uterine fibroids.
Wow. Wow, that's quite interesting here. When someone ends up having, fibroids, what is it that they need to do? Now that they've been told that now we think you have fibroids, what next?
Okay, we really do not need to intervene per se, depending on how you present. At times you may just have fibroids and you don't have any symptoms. It may actually be found by just a routine, or rather noted on a routine ultrasound, maybe a pregnancy a prenatal ultrasound. Those are scans that are done during pregnancy. Okay. Or at times a woman may present with some symptoms, especially depending on the location of the fibroid in the uterus. They may present with things like pelvic pain, heavy bleeding or prolonged menses, difficulty conceiving.
So these are the, what exactly? The signs?
The signs. I mean the symptoms, the symptoms. Yeah, difficulty conceiving or recurrent pregnancy losses. So when you have these, then it's when we may decide to now kind of think, do we need to intervene? They're basically it's a stepwise. There's a stepwise way of managing uterine fibroids. From the very simple, whereby you can just use painkillers or drugs to reduce bleeding, up to the extent whereby you may need to remove the whole uterus. So it depends on how you respond to treatment and how you present.
And we will get into that aspect of removing the whole uterus later on.
Yes,
because I would like to find out why. Is that the solution for it? But you know, what about the menstrual cycles? The blood, you know, during the process of bleeding. How does that, you know, in correlation with fibroids?
Now, a fibroid may be located on various parts of the uterine muscle. The uterus is basically made of it's basically a muscle. So you may have a fibroid that's on top, like on the surface. We call it subserosal fibroids. Now, the ones that are on the surface, on the outer part of the uterus, usually present with things like bloating or pressure symptoms. Okay, then you may have a fibroid that's within the muscle. It also depends on the number of fibroids. If the fibroids are too many or very enlarged, again, you may have things like pressure symptoms or distortion of the uterine cavity, making you have things like pregnancy losses.
Does fibroid at the end of the day destroy the uterus?
Not really. We'll get into that.
All right.
And then there's a fibroid. You can have a fibroid on the inner surface of the uterus. If you have a fibroid on the inner surface, on the inner cavity, those are the ones that mostly present with excessive bleeding. Or irregular menstruation, prolonged menstruation.
What about heavy, you know, heavy menses?
Yeah, that's what I'm saying. If it's on the inner surface.
If it's on the inner surface,
yes,
that's when it gets heavy.
Yes.
All right.
Because as you're bleeding, you know what usually gets your menses because of the lining of the uterus getting shed off. Okay.
All right.
Yeah. So when you have a fibroid on the inner surface, as you're shedding off this lining, the surface of the fibroid gets slowed and then it like ulcerates. So you end up bleeding.
All right. Then, but then, what makes it, you know, grow, the fibroid itself?
It may change in size with time, depending on certain issues in one's life. The main thing is just it has been shown that if you've stayed for a prolonged duration of time without conceiving, you don't get the break from the hormones, so you end up getting the fibroid may end up becoming larger with time. And that is why when someone has fibroids, we usually tell them, okay, especially if you're in your reproductive, not really reproductive, like maybe if you're in your 30s and you don't have any children, we'd actually ask you to try and accomplish your family size before it becomes bigger, and maybe it will later on interfere even with your fertility. Secondly, it can become bigger because of, like I've told you, when it changes into cancer, when it changes into uterine cancer. And also the other thing is, during pregnancy, at times during pregnancy, it may enlarge in size, and after pregnancy, it goes back to its pre-pregnancy
So getting pregnant has an effect on fibroids?
Yes, it does. There's some changes that occur on the fibroid during pregnancy.
Some ladies are normally told, that, and you've alluded to that for you to avoid this, it's like you need to get pregnant early. But the question is, how early is early? How early are we talking about? From someone who is as young as 25, as young as 20, and you're told you have fibroids. What do you do? How early is early that someone needs to get pregnant?
Okay, now we are going into the myths about uterine fibroids.
Okay.
Yeah, in that there's a myth that once you have fibroids, you have to have all these signs and symptoms, and that the fibroid will affect your fertility. But that's not the case. It depends on the number and the size of the fibroid.
Oh, it won't.
Yeah, so if it's a small fibroid, actually an ultrasound wouldn't, at times an ultrasound can't pick all the fibroids you may be having. You may be having very small fibroids that will be missed on a scan. So it depends on the fibroids. If they're really, really large and they're causing symptoms, like pressure symptoms, making you bleed, making you lose pregnancies, then we'll tell you to just try and finish that job earlier. Otherwise, if they're just like small ones, undetectable ones, then there's no reason for trying to get babies earlier.
There's no reason. There's no cause for alarm.
There's no cause for alarm.
And what about the point that it now begins to grow until it looks as though you have a swollen stomach there?
Now, when it grows excessively, it makes the uterus become enlarged. So it may start pressing on other things like your intestines, your bladder, or some tubes that lead blood. urine from the kidneys to your bladder. So you may start getting some symptoms like reduced urination, bloating, constipation, frequent urination. At times, you can even press on your diaphragm like someone who's pregnant and make you having difficulty breathing.
And then you end up being asked, are you pregnant? How long are you?
Yeah, I know. So it depends just on what the patient wants. So you can also remove it for cosmetic purposes. Like it's so big, you're not pregnant, but you don't look normal. Then we may go in and remove the fibroids, or even remove the whole uterus.
All right. Okay. Now that we are talking about the swollenness of the stomach, can fibroids make you, have an increase in weight, and its effect on even on the belly fat?
Not really. Yeah, not really. But women who are of bigger weight have been shown to be more. Some studies have shown that they're more predisposed to getting uterine fibroids than people who are lean.
So the heavier you are?
Yes, there's some risk.
Wow.
Yeah.
All right. So, and does that depend on the age and the height? Because we normally have, the factors to say that now at this level you are considered to be obese, and at this point you are not considered to be obese. Does that have a dependency on that?
Yeah, because the BMI, the BMI is calculated using your weight and your height. So yeah, there's a fact.
There is a factor.
There's a consideration to that.
Interesting. That if at all you have any questions with regards to fibroids, you can be able to send them in using our Twitter handle at KBC Television, at Jane Ombui, at Ram Aguko. The hashtag is Good Morning Kenya. Also at MPSHA, at R. Obade, who is joining us this morning. Let's talk about the aspect of infertility. With regards to fibroids. Can fibroids cause infertility? Fertility.
Okay, not really directly per se, but yes, it can distort the cavity, the uterine cavity, or it can be close to like the tubes, so obstructing movement of the sperms to the ovulated egg in the uterine tube, or even just the distortion on its own may make you start getting, not really being infertile, but making you get recurrent pregnancy losses, or leading to, or make you even get preterm labor, that is going into labor prior to being at term.
And miscarriages?
Yes, miscarriages, that is the pregnancy losses, recurrent pregnancy losses, especially if it's a fibroid that's inside the inner cavity of the uterus. Then the placenta may end up not planting on a good surface. So you end up getting reduced blood, reduced nutrition to the growing fetus.
But at the same time, you're talking about encouraging the ladies to get pregnant quickly. Yet there is the risk of, losing the pregnancy at the same time.
It depends on the size of the fibroids and the number.
Depends, huh?
Yes.
So how can I know that I'm not going to risk losing my baby?
You cannot predict that, because actually many a times we go in for other surgeries or even for a cesarean section because of other reasons, like maybe a repeat C-section due to a previous scar on the uterus, and then you find that a woman has quite large fibroids and they did not know about it, and they still managed to carry their pregnancies to term. So you cannot tell someone don't get pregnant because you're at risk of a miscarriage because you have fibroids. We usually just alert them, yes, you have fibroids, there's a risk, but we can stop you.
They normally say, statistics, that once you are at the age of 50, there is a higher chance of you getting fibroids. Let's look at, the young ladies, the young female, people who are still growing up. What are the chances of them getting fibroids?
Okay, I can't really give an exact statistical estimate, but some studies have shown that usage of some like contraceptives, like the daily pill, at a very early age, a large BMI, as in being overweight, usage of alcohol, can predispose you to uterine fibroids at an early age. But what you said, that's wrong. That's not how it works. Actually, when you go towards 50, you're going into menopause. So if you have uterine fibroids, the ovaries stop working as you go towards menopause. So the fibroids tend to actually shrink, not become more frequent. out. Yeah.
I have a friend who is 27 but has fibroids.
Yeah.
What would you say in that case?
If she doesn't have children, okay, first of all, I'd like to know
Doesn't have
how large
children,
are the fibroids? How
not
large is
married?
the uterus? How bulky is the uterus on an ultrasound? And has she had any history of miscarriages? Does she have any history of maybe excessive bleeding during her menses, or prolonged menstruation, or chronic pelvic pain? So depending on those reasons, it's when I'd decide whether to intervene or let it be.
What about food? Can food bring in, how does your diet affect fibroids?
I have never come across any relationship between diet and uterine fibroids, but maybe I can just, if I can angle it, maybe towards the aspect of excessive calories, weight gain, risk of uterine fibroids, that aspect, but not direct that this food will make you have fibroids. Yeah.
So we don't have food that can increase your chances of getting fibroids?
I've never come across any, and I've never come across any in literature. Yeah.
All right. What about preventatives?
There is really no way to prevent it.
It cannot be prevented?
Because, like I said, it's genetic and hormonal. Or hormonal. So there's really, I don't see anything you can do to reduce your chances of getting uterine fibroids. Yeah.
So once you've
if your mom or sister has fibroids and you're a lady, you have an increased chance of getting fibroids. You can't stop your mom or sister from being your mom or sister.
Wow. That's quite interesting there. So if a lady, let's say, wants to go through the process of treatment for fibroids, what should he or she look out for? Treatment.
All right. Now, initially we usually start with what we call conservative management. And conservative management basically means managing the symptoms, not treating the fibroids. There's no medication for treating uterine fibroids, for making them disappear per se. I'll go into that deeper later. But it's like when you come with a fever, I'll give you some paracetamol. It will sort the fever, but I wouldn't have sorted the cause of the fever, you get? So if someone comes with pain or excessive bleeding, you start by giving them painkillers and medicine to reduce the bleeding, but the fibroids will still be there. The type of painkillers that are recommended are a group of painkillers called non-steroidal anti-inflammatory drugs. These are medicines like Brufen and diclofenac. If that doesn't work, you step it up. Some studies have shown that the daily pill, the daily combined contraceptive pill, like Femiplan, Microgynon, sorry for mentioning brands on your show, okay. But like those ones, they've been shown to reduce the symptoms and also can control the bleeding. Then after that, if that doesn't work, you can consider the option of putting in a hormonal coil. So how the hormonal coil works is a contraceptive coil that's put inside the uterus. How it works is it thins the lining of the uterus, so making you have less bleeding during your menses. All right?
So yeah, we're just talking about control.
Yeah, management. I'm going towards, we're talking about conservative treatment. Okay. Conservative treatment. So you put in the hormonal coil. Then if that hormonal coil doesn't work, now the next angle will to make you go into menopause, in quotes. Now, making you go into menopause means we give you some medication that will stop your ovaries from producing the hormones that I've told you contribute to uterine fibroids. That is estrogen and progesterone, mostly estrogen. So this injection is given monthly or 3 monthly. The main issue with it is that you may end up getting the menopausal symptoms. Things like hot flashes, mood swings, sleep disturbance, bone pains, but especially...
Regardless of your age?
Regardless of your age. Even if you give it to your 25 years of age, you'll have the menopausal symptoms.
So, but they will never get a child.
Okay, I'll explain.
You'll explain that? Yes. All right.
But now the main thing we usually worry about is bone loss. It makes you get bone loss. You may end up getting brittle bones. So you may need to give again some add-back treatment for the bone issues. Now, when you're not getting this hormone produced by your body because of the jab we are giving you, you will not be able to get pregnant. So basically, what you just implied, what you just said, which is actually very right, treatment depends on the woman's fertility needs. Does she want to get children, or is she totally done? If she's totally done with her family size, she's content, then you can go to an extent of removing the whole uterus or removing the fibroid. Now, you remove the fibroids only if...
But retain the uterus.
But retain the uterus. You remove the fibroids if the patient still wants to have children. But know that during the fibroid removal surgery, there's a risk of excessive bleeding.
But now here we're talking about a lady who is still young and wants to get married, wants to bear children. But now he wants to go through the process of treatment of fibroids. Is there a possibility of this lady ever having a family?
Yes, there is, depending, remember, on the size and the number of fibroids and the symptoms she presents with. If she has those symptoms that are making her anemic and all that, then we can do the stepwise treatment I've just explained up to an extent of whereby we go for a myomectomy. That is trying to remove as many fibroids as we can.
That's the myomectomy?
The myomectomy.
Okay.
But know that even when we are removing the fibroids, there are some that may be so small that may not be visible to the human eye, such that later on, she may still get more fibroids.
Wow.
Yes. And when she's signing consent to undergo the fibroid surgery, she has to consent to removal of the whole uterus, just in case in case the surgery becomes complicated. Yeah.
And there's a possibility of it becoming complicated.
Yes, if there are too many or too large, you may end up you may remove the fibroids, but because of the excessive bleeding and all that, we may have to remove the whole uterus. So you have to consent to the two surgeries.
You must be open up.
Yes, because we cannot
it can go both ways.
Because we cannot wake you up during anesthesia to now tell you that now we are unable to help you over here. I think we need to go down with the uterus. Are you okay? Do you want to sign for us to remove the whole uterus?
You just remove it without consent?
No, you have to consent to both. If a woman decides to consent to a myomectomy only, then
it's a consent also.
Most of us will not go in for that surgery, because now if she bleeds excessively, what are you going to do? Yeah.
Wow. Quite interesting there.
Yeah.
And, you know, there are certain myths that people have with regards to, you know, fibroids. And most people go for different beliefs. Some are spiritual, some are, you know, backed up with maybe some knowledge somewhere that maybe you got from your grandfather, your grandmother. But there's one thing, that there's a myth that if fibroid is left untreated, it continues to grow as you age. So if you have fibroids at a tender age, the more you grow, the more it also grows with you. Is that true?
Okay, I haven't really come across anything to prove that that actually happens to everyone. But yes, it is said that the more you continue, the more you have the fibroid, the longer you have the fibroid rather, it may increase in size, or they may increase in number, and that is why we usually tell you that if the fibroids are causing symptoms, try finish your family size earlier so that later on you don't have issues. But know that when you get to pregnancy, when you become pregnant rather, or when you get into menopause, again, there are some changes that occur on the fibroid.
All right.
Yeah.
So if a lady has, you said the fibroids depend on how large or small it is.
Yes.
If someone has a small fibroid, is it better for them? And are there chances, because there is also a belief that as long as you have fibroids, your menses will always be heavy?
Okay, yeah. Now, there are, I think, 3 myths also I come across, especially with patients I deal with. One of them is that they believe that if anyone has abnormal bleeding, excessive bleeding, or prolonged bleeding, or bleeding after sexual intercourse, then they have fibroids. That's not the case. You may have uterine fibroids with no symptoms. Another misconception I've come across is that If you are suspected to have uterine fibroids, when you do an ultrasound, it will show the fibroids. It will show that you have uterine fibroids.
It doesn't.
That's not the case. It depends on the size and the number of the fibroids that you have. Yeah. Which one else? These are the main two misconceptions I've come across concerning fibroids.
What happens if someone does not go for the treatment?
It's the same thing I was saying. Like, a lot of people have uterine fibroids but are asymptomatic. That means they don't have any symptoms. So as long as they are asymptomatic, well and good. Leave it. Let them be.
You let them be?
Yeah.
It's okay.
Yeah.
Interesting there. As long as they are, you let them be. And there is the deep, aspects of how expensive it can go. You've talked about going for surgery. It can either go one way or the other.
Yeah.
In terms of expense, how is it? Is it pocket friendly?
Now, surgical management, there are two main types of surgery, the myomectomy and the hysterectomy. A myomectomy is removal of the fibroid, hysterectomy is removal of the whole uterus. And then there's the aspect of interventional radiology. This one entails doing some procedure whereby you block blood vessels that bring blood to the uterus, so it reduces your symptoms but may affect your fertility. Now, unfortunately, interventional radiology, especially for, it's called uterine artery embolization, hasn't really peaked yet in Kenya.
All right.
I don't know the exact cost. I can't say the exact cost of where it's done for obvious reasons, but it is a bit more costly
Than the other two?
Than the other two. Then now, when it comes to a hysterectomy or a myomectomy, it is, I don't know, pocket friendly is relative. It's relative, okay?
You're right, you're right.
So, in most public, at least level 4, level 5 hospitals, this is commonly done. The main issue may be probably the waiting time. I've worked in a public hospital somewhere a while back, whereby you'd be given a waiting period of even a year or 2 years before you have your procedure done.
Would it have an effect on you,
But now, you don't have control over that. Yeah? And now the other thing would be to go to a private facility. It can be a bit costly depending on the private facility you go to. And also depending on the type of expert who does it.
Do we have enough experts in the country?
This is supposed to be ideally managed by an obstetrician gynecologist. There are quite a number. I think there are almost 500 or so in the country. Which of course are not enough considering a 48 million population. Right. And also there are some corners of this country whereby you'd go and find only one gynecologist in the whole place, and yet almost 40% of black women have uterine fibroids. We
will talk about that.
Yes.
Some areas have only one.
Yes.
Obstetric gynecologist.
Yes.
Only one.
Yes.
Yet we have a large number of women who are maybe having fibroids.
Yes.
We are taking a short break. This conversation still continues. Keep the tweets coming in. The hashtag Good Morning Kenya at KBC Television, at Jane Wamboy, and at Ram Agugo. Also tag them at MP Shah Hospital. Do not go too far.